Kanikah.
Oh Lord, you're the photographer.
How do you spell your name?
Don't make me look bad. Kanikah. Let me know when I can go.
You can go.
Oh. Good evening. Good evening. Good evening. Good evening. Good evening. Hi. Springtime is coming around. It's not quite here yet, but we all can feel it on certain days, or on certain hours of certain days. Imagine a child with what starts out as a runny nose, a slight cough, maybe a little fever. It's nothing to most parents, right? It's that time of season. Everyone's getting sick. You give a little Tylenol, you hope it'll wear off. But the next day, the child who was running around with the fever isn't doing it. They're laying down all the time. They're sleepy. Eyes are glazy. They're just weak. Give a little more Tylenol, because that is all you can really give a sick child these days. Still, nothing. So as a parent, what happens? You start to get worried. You take the temperature, 103.5. Oh my gosh, what do I do? What do I do? A trip to the ER, praying that the doctor can say, it's a little virus that's going around, and then suddenly, in the back of your mind, hits you. Is my child up to date on all of her vaccinations? I am a 22-year-old mother with a daughter who is almost 2, and I try my best to keep her up to date on all her doctor visits and shots, even though I'm a workaholic. I believe that everyone in this class can benefit from the speech that I'm about to give today, whether you have children or not, about how important vaccinations are for young children. Even if you don't have children, you can learn how important they are, and you can remember, even if you do have children in the future. In my speech, I'm going to be discussing the origin of a few vaccines, how vaccines protect us as human beings, and how vaccines have evolved to become safer, and why it is important to vaccinate our children. Vaccination began in 1796 by Dr. Edward Jenner, who invented the smallpox vaccine. By 1809, Massachusetts was the first state to have mandatory vaccination. By February 1905, vaccination was made mandatory by the Supreme Court for all children attending public schools. By April 12, 1955, Dr. Jonas Salk announced that he had developed a vaccine for polio, a disease that crippled, paralyzed, and sometimes even killed thousands of children in the United States. The National Polio Program was developed in 1965 and had reduced the number of paralytic patients by 61. In 1993, Congress passed the Child Immunization Act of 1993, increasing the percentage of children who could receive vaccinations. As a result of this, the Vaccination for Children program, otherwise known as the VFC, provided vaccinations free of charge for children across across the United States. Now that I've discussed an origin of a few of some of the vaccines, I'd like to discuss how vaccines protect our children. All states require certain vaccinations for children entering public schools. Some of these vaccinations rule out illnesses such as measles, mumps, and rubella, otherwise known as MMR, and whooping cough, which once killed thousands of infants annually. Depending on the state, children must be vaccinated for either some or all of these diseases. These diseases include, once again, measles, mumps, and rubella, diphtheria, tetanus, pertussis, and polio. All vaccination isn't required in all states. 48 states have exemptions for religious reasons. 20 states have exemptions for philosophical reasons. The Centers for Disease Control and the American Academy of Physicians recommended that children be vaccinated against 15 different childhood illnesses. On July 9, 1999, in response to a link between vaccination and autism, the American Academy of Pediatrics and the U.S. Health Service recommended that thimerosal, which was seen as the link between vaccinations and autism, be banned from all vaccinations. Now, thimerosal is a neurotoxin, or otherwise described as mercury to some. Thimerosal was used in the early 1930s as a preservative for vaccines. Many people believe that thimerosal was just used in vaccines, but they don't quite understand why the thimerosal, or quote-unquote mercury, was used in vaccines. But thimerosal is used as a preservative agent. Thimerosal was used to kill bacteria that might be in the vaccine during its production, and thimerosal is used in vaccinations that require multiple doses. So if you work in a center where you have a big jar of a certain vaccination and you have to keep injecting a syringe to give doses to patients on different days, a small amount of thimerosal is in that vaccination just to prevent bacteria from entering the vaccine every time you stick a syringe. Now, thimerosal is said to be 2 to 3 micrograms per milliliter of a vaccine. So that's how small the amount of thimerosal, or quote-unquote mercury, is in vaccines. Now, preservatives for thimerosal is not required for a single dose of a vaccine. It's only required in multiple dose vaccines. And there are also many vaccines that are out there without thimerosal, or quote-unquote mercury. And many parents who are taking their children to be vaccinated can ask, if they're still not sure, can I have a vaccine that's mercury-free? And it is provided. As of January 14th, 2003, actually, thimerosal or mercury has been removed from all pediatric vaccines. So if there is any trace of thimerosal or quote-unquote mercury, it is in adult vaccines, not in pediatric. Vaccines can eradicate disease and prevent illness and death. According to researchers at the Pediatric Academy Childhood vaccinations in the U.S. prevent 10.5 million cases of infectious diseases per year and stop 33,000 deaths per year. Even if a child has been vaccinated and still gets sick, their symptoms are way less than a child without a vaccination. In 1933, a researcher by the name of Hedrick made a theory that in order for a population to be completely immunized, we must all be healthy, and we must all receive our vaccinations to be healthy. So when we are all healthy, we all can eradicate disease. In conclusion, I have discussed a few origins of the vaccines, why it is important to vaccinate children, how vaccines have evolved over time, and the diseases that can be prevented. I hope by this discussion, I have opened the eyes of many individuals in this room as to why we need to protect our children and our community